Salmonella outbreak more than doubles. CDC identifies a potential source. A salmonella outbreak with no known food source has more than doubled in infections in a little over a week. On September 15, the Centers for Disease Control and Prevention reported 127 people in 25 states had been infected with salmonella, resulting in 18 hospitalizations. On Thursday, the CDC announced the number of reported illness had more than doubled. 279 people have been sickened, and the outbreak has reached another 4 states. Additionally, there are now 8 more people in the hospital due to the food-borne illness. To stay up to date with latest top stories, make sure to subscribe to this YouTube channel by clicking the button above this video. On September 2, 20 people were reported sick by the strain of Salmonella Oranienburg. Since then, the CDC says the outbreak has grown rapidly. State and local officials have identified a possible food source that is causing the outbreak, but food samples have been collected from restaurants where the sick people ate. They discovered salmonella in a condiment cup with cilantro and lime in it. Because multiple food items were present in the container and in the sample that was tested, it is not possible to know which food item was contaminated. We are using this information in conjunction with other available information to help narrow the list of possible foods linked to illness, the agency said in a statement. Health officials say that they think the actual number of infections is higher than reported, but some people don't get sick enough to go to the hospital. It can also take up to 4 weeks to determine whether someone was part of an outbreak. CDC data shows the outbreak has stretched across the U.S., Texas, 81, and Oklahoma, 40, have the most cases. Other notable states with outbreaks include Illinois, 23, Virginia, 22, and Minnesota, 19. The infected people have ranged in age from less than a year old to 89 years old. 59% of sick people are females. No deaths have been reported. Kansas also has some cases. Symptoms of salmonella infection include diarrhea, vomiting, fever, stomach cramps, and dehydration, which can begin 6 hours to 6 days after being exposed to the bacteria, according to the CDC. Most people recover without treatment after 4 to 7 days. Children under the age of 5, people 65 years and older, and those with weakened immune systems may experience more severe illness from salmonella. Last month, 862,000 pounds of uncured antipasto products were recalled for possible salmonella contamination that caused sickness in people across 17 states. The CDC recommends people practice food safety measures such as cleaning utensils, hands, and foods, as well as separating different foods and making sure all food is cooked to a high enough temperature. The agency also recommends refrigerating perishable foods within 2 hours and thawing foods in a refrigerator.